Why is my pregnancy hormone low?
You may have had a lot to drink.
That's how I think I may have gotten pregnant. Not explain why the hormones test low now.
They recommend you do pregnancy tests with first morning urine when the hormones in it are at the most concentrated. Later in the day, having a lot of water to drink dilutes it so that it doesn't test as concentrated.
I'm worried that the low pregnancy hormone may indicate something is wrong.
The pregnancy hormone levels double every few days until well into the first trimester. It is going to be low early on but should rise with time until leveling off.
Does it ever drop off?
I hope it drops off after you have the baby.
I mean after a pregnancy test.
You can get variations between pregnancy tests results early on. Like one of those ultra-sensitive, ultra-expensive pregnancy tests showing results, but a less sensitive one not showing a result or a faint line.
That means the difference is between the tests.
That's why they sell single pregnancy tests next to bulk packages of pregnancy tests.
I should not see a decrease in pregnancy hormones after the first test though.
The first test of a day should show up stronger with the most concentrated urine, with a later test in the day having lower hormone levels via a paler stripe after you've had something to drink.
Not that discussion again.
Another possibility is that you were pregnant, but you've miscarried, so the hormone levels are dropping.
Does that show up on a pregnancy test?
The typical way would be a positive pregnancy test followed by not so strong test results followed by negative results, by which time you should see biological results.
I have not had bad cramps or signs of a miscarriage.
Remember that you have to be a few months along for the kid to be the size of your thumb. That's why all the pregnancy calendars compare the kid to the size of melon balls and peas, not bowling balls.
So you're saying I could have miscarried and not noticed it?
You'd notice that your period was late and maybe a little heavier, if that's why the pregnancy hormones are declining.
Because I'm not pregnant anymore.
If you're lucky, your hormones are simply not rising as fast as normal. But if in doubt, talk to a doctor.
By the time I get into a doctor's office, I'll know one way or the other why the test results are what they are.